Good afternoon, everybody. One industry might be the heroes of the bumpy vaccine rollout in the U.S., drugstores. Drugstores are everywhere, of course. 60,000 pharmacies are spread throughout the United States, and they're ready to come to the rescue. Michelle Cortez covers health technology for Bloomberg, and she joins me now. Michelle, it's always great to have you on Quick Take. Thanks so much for joining us on this Friday afternoon. Walmart saying this morning that it plans to give vaccines in at least 7 more states. They've already been giving vaccines in a couple of states to people who are eligible. How big of an effect would this have, would this make of companies like Walmart, CVS, Walgreens start giving vaccines?
It's going to be critical for pharmacies and other outlets who give vaccines to go all in when it comes to coronavirus. We have to vaccinate the entire country, and we have never tried to do anything like that before. So if we don't have pharmacies not only participating, but participating in a very smooth and efficient way, then we're never going to get to that 330 million coverage. And of course, 2 doses for each vaccine at this point, so 660 million. It's a huge undertaking. And if the pharmacies can pull it off, then we're all going to be better for it. But it is going to be a huge lift for them.
Why is it going to be such a big lift for them? I mean, pharmacies are used to giving flu shots. Obviously, it's a different task than giving flu shots. These need to be kept at cooler temperatures. But what are the challenges that lie ahead even for logistics professionals like Walmart?
Yeah, well, that's exactly it. The biggest hurdle, of course, for them is probably when it comes to the Pfizer and Moderna shots, that cold chain distribution. They have to be thawed, they have to be conveyed at a certain temperature, they have to be thawed and administered at one time. So you can't thaw them out and then put them back in the refrigerator and, parcel them out over the days to come. So you have to be incredibly organized and efficient when you're doing it. Not only that, the shots come in large numbers. So it's not like you can just, take a dozen of them or so and pull them out as you need them. They come in 50 to 100 lot deliveries. So there's a lot of vaccine that they have to be dealing with. And then there's, of course, the individual people issue, right? You have to get people to be signing up, but you want to make sure that you're having enough people sign up so that you have people waiting for the vaccine, not the vaccine waiting for people. That being said, sometimes people just don't show up. You don't want to have too many people in your waiting room at CVS, hanging out at the Walmart, because of course, everybody is vulnerable to this virus at this point. So you have to really manage your numbers. It's going to be just a lot of work for these groups. They do it, so they are familiar with the process. They just don't ever do it at this scale. So it'll be interesting to see how they scale up.
Well, Michelle, I know this is something that you watch closely. Vaccines in the United States started being administered a little over a month ago on December 14th. And I'm looking at Bloomberg's vaccine tracker right now. And since December 14th, the United States has administered 18.4 million shots. We are more than a month out from that first, or a month past, I should say, that first dose that was given. Taking a step back and just thinking big picture, what continue to be the challenges that cities and states face in the rollout of the vaccine?
Well, as we just discussed, the biggest challenge is going to be simply the numbers. So of that 18 million who have gotten a shot, less than 2.5 million of them have gotten both shots. And so what that means is that we have, 15 million people out there who are waiting for their second shots. Meanwhile, we're opening up access to the vaccines to everybody age 65 and older. That's another 50 million people, not another 50 million people, but it increases the number of people eligible to 50 million. We don't have enough shots for all of those people at this point, number one. Number two, as we get these increased numbers of people coming in for their first shot, and we have the carryover of all of those who got the first shot who need the second shot, you can see that the numbers are going to grow exponentially here. The states are going to have to take really innovative approaches to make sure that they are organized enough that they're getting it out to everybody, not only in pharmacies, but we're going to need massive vaccine clinics. We're seeing it in some places like Disney World and Disneyland where they're giving vaccinations. Many sports stadiums are being co-opted and getting into this process. I really do think that it's going to have to be a national effort. We do see nurses, doctors, health professionals willingly donating their time, going out there to administer these vaccines. The numbers are phenomenal across the board where we're going to need to do this. And of course, everybody wants it now. So managing expectations, also critical.
Yeah, that's why it was surprising for me to hear that people aren't showing up, because given how much I want this vaccine and so many people around me want it, it's surprising to think that people would miss their appointments. But that happens. 48 hours it's been since President Biden took the oath of office and was inaugurated as the 46th president of the United States. Yesterday, we saw him and his team unveil this 198-page book about the national strategy when it comes to the responding to the pandemic. What are your initial thoughts and observations about the differences between the Biden administration's approach to curbing the pandemic and the Trump administration's approach over the last 10 months?
The biggest difference between these two administrations is going to be the focus of the effort. The Trump administration really did believe that they needed to do the back work, that they needed to, for example, help develop and distribute the vaccine, but not actually take the next step and get it to people. They were leaving all of that to states. We saw that again and again. We saw it with PPE, we saw it with testing, now we're seeing it with vaccines. The Biden administration really wants to have a top-down process. So they are going out there not only in terms of giving direction and recommendations of how the state should behave, they're also giving money to help the states get to where they want the federal government wants them to be. So it's this interesting push that we've seen. Not surprising, right? That's Republican and Democrat. That's the differences that we see in the political parties themselves. So certainly we're going to see whether big government is going to be able to get this done more efficiently than individual states. Certainly having the money at the state level is going to help. The other really big crucial thing that I think is a difference here is that the Biden administration has said that they really want to improve communication, and they're interested in making sure that the American people can go to the federal government to get the information that they need. We're seeing that across the board here now. Nobody knows who has what vaccines and where they are. So the Biden administration is saying that they do want Americans to be able to go to the cdc.gov website and track where the vaccines are. That kind of information is something that nobody has at this point.
Michelle, we just got some breaking news that I want to get your thoughts on, with the caveat that I know you haven't had time to report this out yet. The UK is now saying that the new COVID variant may be linked to higher mortality. This is a redhead crossing on the Bloomberg terminal right now. What are the initial questions that need to be asked for when you see a headline like that?
So you're right. I haven't seen that now, but I do have thoughts. So number one, we know that there's going to be increased deaths when it comes to this vaccine or this variant, regardless of whether or not it's actually increases fatality rates. And that's just simply a matter of math. The variant infects more people, it transmits more quickly, so more people will get it. Even if you had the same number of the same proportion of people who are dying from getting the virus, if you have more people getting the virus, you're going to have more mortality. So we knew that deaths were going to rise as a result of this variant. The point that I think that what's coming across here is that the actual variant itself has a higher mortality risk than the wild type. That would be really devastating news, because that would mean that not only is the virus going to be circulating more quickly, it's going to be killing more of the people who it affects. So that's going to be a double whammy. We're already seeing exponential growth with that variant. If you see exponential growth and addition higher mortality, that is quite bad news.
All right. Michelle, we are going to have to leave it there. Thank you, as always, for joining us on Quick Take this afternoon. That's Bloomberg's Michelle Cortez joining us live from Minneapolis.